I'm absolutely delighted now to be joined by David Kupfer, who is the chair, as you all know, of the DSM-5 task force. Dr. Kupfer, thank you very much indeed, first of all, for coming to talk to us today.
Well, I'm very excited to be here. I'm very excited to talk about DSM because, as you know, yesterday was the launch.
It was indeed, and it's 20 years, broadly 20 years since the DSM-4.
It is 20 years. It's been a long journey. We think it's been a very successful journey. We've reviewed many of the advances that have taken place in the last 20 years, and we've made a number of changes which we do think will improve the clinical assessment for patients and their families by various types of mental health clinicians.
Tell us a little bit about some of the headlines, if you will, of the changes.
Well, I think one of the things that we paid attention to this time, which I think was very important, was the whole issue of a developmental approach, since many of our disorders begin in childhood and adolescence. And so really throughout the manual, there is a greater sense of a developmental lifespan approach. The second thing that relates to that is, again, paying much more attention to gender, much more attention to cultural diversity and cultural sensitivity, and that again is something really pervasive throughout the book. The organization of the book is also interesting and somewhat different from previous DSMs. We think that there's a very good introductory section on how to use the book, which we hope people will read. Section 2, of course, contains the diagnostic criteria for the various categories, and Section 3 is really a section that deals with emerging measures and alternative ways of thinking about models for personality disorder, as well as a number of conditions that we hope people will study, which are not necessarily ready for prime time. The organization of the main section of the book is also interesting because what we've done is that we've organized it in 20 chapters, a number of disorder areas such as bipolar disorder, PTSD, basically have their own chapters, which we think are important, if you will, statements to make about the need to address those particular issues, as well as the other 18 chapters, if you will. And the chapters themselves have been organized in various clusters that lend themselves much more to being receptive to some of the advances in neuroscience and genetics. And another reason that the chapters have been organized the way they have is because this is a strong possibility of having this be much better coordinated with the International Classification of Disorders, the ICD-11, which will come out in approximately 2 years.
I mean, the whole point of DSM-5 is it's a tool, it's a manual for clinicians, isn't it, at the sharp end?
It is really a set of guidelines for clinicians. It is for them to use. They need, of course, to use other things as well, and not just use the criteria set.
There's been a lot of controversy around the launch of DSM-5 and a lot of it around research. And what's your view on some of the controversy that there's been around?
Well, I think sometimes it is misunderstood that the DSM is a research tool. It can't be the leader in terms of research. It needs to be ready to utilize research findings and make them amenable for clinicians to use them as criteria and quantifiable measures. We hope that this will continue and continue even more quickly than it has up to now, which is one of the reasons that we really decided to make this much more of a living document and allow the probability, if you will, by making it a 5.0 in many respects, that there'll be a 5.1 and a 5.2, and we won't have to wait 20 years for incorporation of new findings. I certainly hope that we will be able to have a 5.1 or a 5.2 that will have a much higher level of insights to some of the basic genetics and neuroscience that relates again to major public health disorders such as autism spectrum disorder, such as bipolar disorder, such as schizophrenia, and so on and so.
Well, Dr. Kupfer, thank you very much. It's been so much work bringing it all together. I'm sure you're delighted to see it launched.
Well, we are delighted, and of course, there are hundreds and hundreds of people that have worked on this project, and they really need to be very proud of what they've done.
Well, thank you very much indeed for joining us today. Really appreciate that.
Thank you.